Often in Western societies, women who are giving birth are offered epidural analgesia, which is given to provide comfort by reducing the pain induced by contractions. Although an epidural catheter is usually easily administered and often well tolerated by women, some women have problems with this procedure. For example, if the woman has extreme pain due to contractions. Also, many women, even if they do not tell their doctor, have a great deal of fear about the epidural procedure itself. Together, these problems can complicate the procedure and interfere with the rapport between the woman and the anesthesiologist. To reduce both the fear of catheter placement and the pain of contractions, we developed and describe here an evaluation of an easily administered procedure that has 3 components: patient rocking, gentle touching, and hypnotic communication. The data were collected by 16 anesthesiologists separated into 2 groups. One trained in hypnotic communication and the other not. Each anesthesiologist was asked to enroll 10 women who were in labor. Before giving the epidural, pain and fear were evaluated using a numerical rating scale from 0 to 10. Whereas 0 means no pain or fear, and 10 the worst imaginable pain or fear. From the lying position, women were asked to sit up and rock back and forth. Then the women were assisted by the assistant and the anesthesiologist The results. Only 11 women refused to participate in the study. 155 were enrolled. When the anesthesiologist first arrived, average pain score was 7.3 out of 10. The average fear score was 5.1. Rocking lowered pain substantially in 3 out of 4 women. The mean decrease was from 7.3 to 5.9. Rocking also lowered the fear scores in 1 out of 2 women. The mean decrease was from 5.1 to 4.2. After touching and verbal communication were added, the 2 groups reported different patterns of change in pain and fear. In the hypnotic communication group, pain scores decreased even more, as well as the fear of the catheter placement. Whereas in the standard communication group, the pain scores remained the same, as did the fear scores. Then the epidural analgesia was put into place. Patient rocking in conjunction with gentle neck touching and hypnotic communication appears to be a very effective and easy way to reduce labor pain and fear of an epidural placement. These easy procedures are proposed as a hypnotic intervention that would be of help to both women and their anesthesiologists. It helps women to gain control over labor pain and fear of the epidural catheter placement, and therefore makes the procedure easier for anesthesiologists.